Good afternoon, everyone. My name is Alison Crocket. I'm the head of the whole systems unit in Scottish Government in Drug Policy Division. And welcome to the webinar this afternoon, which is entitled Young People in Drugs, Early Intervention and Harm Prevention. So we've got a really useful and interesting, I think, group of speakers for you today. I just wanted to sort of say just up at the front that I think everybody it would be in agreement that early intervention and harm prevention around drug use is preferable. Everybody would prefer that people did not get themselves into the sort of crises and difficulties that they might have done, that they do at times. But there is not a universal acceptance or agreement about what the definition of any of that is, early intervention or harm prevention. So I think I should just really say that for today's purpose, we're going to concentrate on planet youth as a model, which is a very particular whole community model on around helping young people to environmentally create an environment in which they would thrive more effectively. And that's something that we at the Scottish Government and Drug Policy Division have supported, because we found the evidence that suggested that it was effective, compelling, and we're being really interested to watch as this grows grows in popularity across Scotland as we've been going along. The people that I'm going to be are going to be talking to you today are the people who actually know a great deal, much more about this than I could ever say. So it's going to be Zahra Hedges, who is the CEO at Winning Scotland, and Morgan Moore, also of Winning Scotland, to really sort of talk to you about what that means, what Planet Youth means, and what they've been doing up until now. Also, Rachel Wells and Alison Munro from Argyll and Bute, who have been doing Winning Scotland, and Laura Keast and Olivia MacDonald from Clackmannanshire. Can I ask everybody, I think there's something in the chat for you, but if everybody's got any questions, we're going to take them at the end of all of the various different presentations. Kirsten Horsborough, who's, as you know, the CEO at SDF, will facilitate the questions at the end. You can ask your question by putting it in the Q&A, type it into the Q&A box on your webinar, on your Zoom screen, and Kirsten will pick it up there and we'll be asking it. So if you could do that as the question occurs to you as the person is speaking, so that they can be taken in order, if you like. So that's going to be for me. What I'm going to do now is pass you on to Zahra Hedges, and she's going to talk to you about Planet Youth. Zahra.
Thank you, and as if by magic, I appear. Thank you so much for having me. We are absolutely delighted to have this opportunity to speak to everybody. And actually, as much as it can be, we'd love it to be a two-way conversation. We are right in the middle of a piloting phase, so although there'll be questions and answers at the end, we're really keen to hear what insights you have for us, actually, what you think what we should know about. And I always ask people, what's your yes but question? What's the thing that, if this were a meeting in a room, I would walk out the room and you'd go, oh, well, that's never going to work because X, Y, Z. Like, we'd love for you to share that sort of thing with us so we can build it into the work that we're doing. So, as I said, I'm the chief executive of an organisation called Winning Scotland. We have been going for about 20 years and we're a very small team. Our mission is to build confidence and resilience in children and young people. Funnily enough, for a charity that has a beneficiary group of children and young people, we don't actually work with them because we recognise that a lot of the challenges our young people have is because of the adults round about them. So our model is to work with the adults round about our children and young people so that they can help children to live healthier, happier lives. We do that in two different ways. We look at the individual, the role of the individual young person and what they can do when they're properly supported to change the lives of themselves and those around them. And that properly supported bit is key because actually the environment that we're growing up in plays such a huge role in the outcomes that we end up living through. So we have a track record in bringing new ideas to Scotland and working with big national partners to implement them, and Planet Youth is our current example of that. So I'm going to hand over to Morgan shortly, who will talk to you more about what Planet Youth is, and maybe a little bit about what it isn't. But I want to tell you about how it started. So in 2018, there was a video that went viral. Some of you may have seen it. It was from the World Economic Forum, and it was talking about the fact that in Iceland, very few young people are drinking, smoking, and taking drugs. And Winning Scotland, as an entity, was already working with well, we worked with all local authorities, to be honest, but we had a handful that we were working with on a very regular basis. And a couple of those came to us to say, this looks really interesting. I don't even know how we'd begin. Can you help us figure it out? So we sent a delegation to Iceland to learn a little bit about what it was. And I will be honest with you, at that point, they were still building it because they had organically reached this point through a combination of social science, experimentation, policy, and then they were reverse engineering it to look back and go, well, what did we do? And is this something that's of value to the world? So they had their first conference where they were starting to bring that together. And we bumped into some people from Highland who were already having those kind of conversations and looking at what they might do. So we decided when we got back to Scotland to create a motley crew of pioneers who would bring this here, not to replicate completely, but to look at what lessons we could learn. And it started around about COVID time. The colleagues who went to Iceland, they came back, I think, on like the 15th of March, and then we went into lockdown a few days later. But we decided to persevere. So we started off very much us and our partners putting in, and it wasn't just local authorities, it was ADPs, putting in a wee bit of resource to see if we could do this. And that was because people realised that a big change was needed. And actually, when we're talking about just say no, that's not necessarily something that's proven itself to be as effective as we'd like it to be over the last 30 or 40 years. So we were looking for a big change, and this is an improvement methodology. As I say, Morgan's going to go through the details. And at some point, and I want to say 2022, I might be mistaken, we got a phone call from someone at Scottish Government because colleagues in the local pilot areas had been talking about this and the work that we were doing. And Scottish Government approached us to say, we're really curious about this. Is there anything that we can do to support it? And we agreed a 2-year pilot, even though the work had started before, a pilot to look at what are the lessons, what are the conditions of success if we were to try and do Planet Youth over here, what will make it work, what are the barriers to implementation, and that's what we're doing just now. That pilot phase finishes in about 2 months, and we'll have our evaluation published in the summer. I just want to say as well, for us, this is not about making things a bit less rubbish for our young people. It's actually about helping them to live healthier, happier lives. And if we get this right, we won't just see a reduction in use of drugs and increase in the age of first use. We'll see more kids having better mental health, better connections with their families and their communities, healthier, better attainment. Like, there's so many benefits to getting this right. So really excited to be here and to hear what you've got to say to us, but I'm going to hand over to Morgan, who will go into more detail about what Planet Youth actually is.
Thanks. I'm going to just share my screen. Thanks for sharing, Zahra. I think the story is interesting. I always laugh when I hear that people just bumped into other Scottish people in Iceland. I think that just goes to show that there was a big appetite for change and things going differently. So yes, this sort of all came about because of these articles and all of this stuff that was happening. I think in Scotland we have this really interesting, but I like to think that we think we're a bit of a Nordic country ourselves. So we take a lot of inspiration for the things that are happening over there. And when these things were coming out, it was really interesting and something that was really difficult to ignore in terms of the fact that there is someone somewhere in the world getting this right and we're still not. So what can we do about it? The big thing we hear, as Zahra said, we quite often are asking people, what is your yes and your yes but? And the big thing always is, but Iceland's not Scotland. We hear this all of the time, and we're very aware that they're very different in a lot of ways. I think the biggest things that are different is some of the structures, but even just in terms of the population of Iceland is similar to the population of Fife, which is actually where I'm from, and worked for a long time in Fife, and getting anything consistently across those 7 areas is quite difficult. So never mind across the sort of length and breadth of Scotland. But that's the whole point of the pilot, has been to learn what can work, what needs adjusted, what do we need to do to adapt this model to our Scottish context. So we're getting closer and closer to understanding what this can and could look like. But this is the really helpful thing, and this is what they call in Iceland, they call it the hero slide or Miss Trendy. This is the thing that gets everyone really excited about Planet Youth. And what's really helpful about what this slide shows us is that Iceland's starting point is very similar to where our starting point is. So what this graph really shows is from back in the 90s to now, how Iceland have managed to go from these really high levels of teenagers, young people getting drunk in the last 30 days, smoking daily, trying cannabis, or more recently, vaping. And the purple number is really interesting, and we're going to talk about that in a second. But I think what's really important is that the things that are similar about Scotland and Iceland is around culture and around those similar attitudes towards alcohol in particular, where we very much drink to celebrate, to commiserate when we win, when we lose. It's really entrenched in so much of our culture, and it was absolutely the same in Iceland. It was really entrenched in all part of their social lives, and for many it was that way since they were a teen. It just was completely the norm. And what's really fascinating is going back to the purple line, because you can see this line where, the same as what we've experienced here, Iceland also saw a spike in vaping. They saw a big increase, but what you can see is that they very quickly became aware of this spike, and they started to change things to bring those numbers down. And it wasn't included in the original questions because it wasn't a threat at the time. So the interesting thing about this is that we need to be aware of the fact that there are always new threats, there are always new things that we need to be asking young people about and listening to what they're experiencing. And I guess this led us to really believe that we, like Iceland about 25 years ago, had reached a really similar point where we're ready and we've got an appetite for some big change. So this is a little bit about what it's looked like for us in Scotland since starting the pilot. We've grown a little bit. We have Argyll and Bute, Angus, Clackmannanshire, Dundee, Highland and West Dunbartonshire as the 6 areas currently delivering on the pilot, and they cover over 24 schools. Across the areas, the people leading that is different in each area because the setups are different in each area. It spans from education in some areas, NHS, community learning development and third sector partners. It's different in each area dependent on how they're made up and who's best fit to lead that. And the pilot was really aiming to see whether Planet Youth does fit in Scotland, and it's being evaluated independently to support our learning and understanding of what's going on and how we can learn from what we're doing now, with lots of hopes for the future of getting more local areas involved. And for each of the areas, going on this journey has been really brave. There are lots of people that really don't want to ask about this kind of stuff. They don't want to ask teenagers what's going on in their world. But what we all know, probably, if you're on this call, we know that just because we're not asking doesn't mean that it's not happening. And there are lots of wonderful things happening across the areas. You'll hear a wee bit more about that this morning. We've got a few areas here to talk to you about what's going on in their world. Some of the challenges, there's been a lot, and I think the pace and momentum at times particularly has been a big challenge. Ensuring the right people involved has been really tricky, and it's really tricky and difficult to just think differently when we're so used to fighting fires. It's hard to have patience when we very much work in a country that often focuses on really shiny interventions or the number of children that have been saved. There isn't really many people that are focusing on the children that were prevented from ever needing saved. But with all of that trickiness, we absolutely have shown, I think, a lot of resilience, a lot of perseverance and determinations that ultimately that we know our kids deserve better. So in terms of what this means, I want to talk you through what one of the big learnings that we had. One of the biggest learnings over the last few years is that when we've talked about the model, we've kind of presumed that everyone is talking about the same thing when we talk about prevention. But the learning is that that's not the case. When we're talking about prevention, not everyone is thinking of the same thing. And this quote really underpins what the concept of upstream prevention really means. There comes a point where we need to stop pulling kids out of the river. We need to go upstream and find out why they're falling in. And what we need to emphasise when we talk about Planet Youth is it's not really about the 15 or 16-year-olds that do the survey. Often they are giving up their time, they're giving their insights for the kids that are going to come after them, and that can be really uncomfortable at times to sit with. But we're really confident that actually upstream sits upstream, and quite often we get midstream and upstream a bit confused. Measuring the success of upstream prevention isn't really about the football clubs or the art classes or the stuff, whatever it might be. They're important, but they often sit midstream. We're hearing a lot of that in youth clubs at the moment, where there's incredible youth work going, but it's really targeted youth work for particular needs. And there's so many amazing charities and organisations working with 14, 15, 16-year-olds, and we want them to keep doing what they're doing. But we want to be clear that Planet Youth very much sits upstream, listening to what the current 15-year-olds tell us about the environments that they're growing up in and that help them make good decisions, and then looking at the kids younger and seeing how we can change their environment now so that when they're answering the questions later, they're answering those questions a little bit differently. So how the model does this is through learning about those 4 core aspects of a child's life and looking at how we can take that and understand what are the risks and what are the protective factors, and increase those protective factors and decrease the risk factors. Really simple. I think when we look at this, we always think it's simple, but it's quite complex when we're going through it and when you're trying to implement it within Scotland. But in a very simple way, we're increasing protective factors, we're decreasing risk factors. And as Zahra said, what we're aiming to do here is really aspirational. It's not about it being a little bit less rubbish. It's about everything being better for our kids, to be able for them to be happier, healthier, safer. And we know that kids choosing and being a part of some of these risk-taking behaviours and trying these things for the first time are not doing so because they think they're going to like it and they think they're going to like the taste. There are so many different factors that lead some of our young people to make the choices that we know ultimately aren't going to serve them. So what this approach does is it takes a data-driven lens to work out what those risk and protective factors are. And it's not about just saying no or expecting teenagers that still have their growing brains to make better choices than any of us as adults make. I think we quite often will stay out for an extra drink, or we'll lose our temper when we're trying to remain calm, had an extra biscuit when we've said we're not going to have it. We know that these things happen, and we know that kids with their growing brains can't be just presumed to make better choices. But it's about creating environments where young people can get that sense of belonging. They have natural highs, they have connection by participating in healthy ways, because those healthy ways and those healthy options are available, they're accessible, they're normal, they're popular. Our kids make great decisions. They can and do make good decisions all of the time, but quite often we are currently putting them into environments that make making good decisions really hard. So how it actually works, a prevention model that is actually evidenced to prevent young people turning to alcohol and other drugs at a young age. How did they do it? How did they change the culture? Very simply, they listened and they weren't afraid to be bold and to change the systems to improve the environment for their young people. Iceland was able to take their prevention model and turn it into a sort of 10-step process for countries around the world to adapt to their context and their local communities. Ultimately, what you're seeing on your screen is a real guideline for systems and culture change. By building the community capacity through getting the right people involved and aware of Planet Youth and identifying that available resource to support community empowerment. And quite often people are surprised to see that getting the data, asking the questions is not step one. people rush towards that data, and of course they do. It's great insights, but actually the data is no help without the right people. So when the data does come, you know that action's going to follow. So to start with, you have to build that capacity within the communities and make sure the right people are around the right tables, having the right conversations about upstream prevention. Then you can go and ask the questions. The real core processes then focus on empowering and engaging communities, sharing the word of Planet Youth and sharing the key insights from what the young people are telling us, and considering what actions locally can be taken to improve the environment, influenced not only by the data insights, but by all of that rich community engagement that they're doing as well. And it's really not the numbers that are interesting to share. We've gone through it. We've gone through lots of fear around sharing the data. And we had lots of big conversations about it's not about sharing the data. It's not that interesting that X amount of young people are drinking, smoking, taking drugs. That's not what's interesting about what we get from these surveys. What's interesting is some of the correlations. What are the insights that tell us about the rest of their life? So the fact that you're more likely to have been drunk in the last 30 days if you don't believe that anyone at your school believes in you, or you're more likely to have been drunk in the last 30 days if you're spending less time with your parents or not involved in out of school activities. So it's about looking at those behaviours, those risk-taking behaviours, and what else is happening around those kids' lives. And then it's only at step 9 that any of the initiatives take place, any of the action takes place once you've done all of that. People are often surprised to hear that it's not the clubs, the activities, the leisure cards, it's a way of thinking. It really confirms some of what we already know, and it gives us a mechanism, a language to really elevate work that's already going on in our communities. It ensures that we really understand what's working and what's not and why. There's no end to prevention work. Our colleagues in Iceland talk about this so beautifully that, there's a clear start date to doing this, but there is no end date. We need to continue doing this. And actually, there's also no one right answer. The data doesn't tell you what to do, but combined with the local knowledge, it helps you work out what to try and test and rejig. So we really believe that we should be building strong children. And to do that, we should be ensuring that they have the right environments that allow them to make really good decisions. We recently launched a new pledge campaign. What's really important about Planet Youth is it's everyone's responsibility and everyone has something to give around prevention, whether that's professionally or personally. So we would really encourage everyone to think about what they can do. So if you want to scan the code, you can pledge something now. You might have thought of something that you know that within your world you can be doing right now, or whether it's later on you can think of something. But we'd really encourage you to think about what can you do, because every single person has something that they can be doing, whether that's about telling someone else about this, whether it's about working more upstream, whether it's about looking at your prevention strategies locally and thinking, how preventative is it really? There is something that everyone here can do. But we have some great people with us today. So I'm going to hand you over to Laura from Clackmannanshire to tell you a bit about their work locally.
Good afternoon, thank you for having me. I'm here to share something that's been really, really successful in Clackmannanshire, something that's come about as a result of Planet Youth and the data, and that has been really, really exciting, and I'm really excited to tell you a little bit about it. So last summer we launched family sessions during the summer holidays in Alloa Family Centre. And this came about as a result of discussing some of the data with our Planet Youth Coalition round about June last year. One of the key things that came out of the data in Clackmannanshire was that, or one of the key strengths was that a lot of our young people do feel that they have positive relationships with their parents. 92% of our young people reported during the survey that they have caring and warm relationships with their parents. And another really key thing was the link between young people who spend time with their parents in evenings at weekends, the impact that has on their mental health, and also the impact that has on their behaviour, specifically around substance misuse or potential substance misuse. And we were able to draw the conclusion from the Planet Youth data that spending time together as a family is really, really a protective factor. Out in Clackmannanshire, there are potentially quite limited options for families to be able to do that, especially in a context where it's quite rural. Transport links aren't very good. There are quite specific challenges to achieve that in Clackmannanshire. But at the coalition meeting, one of our members, Lynn, is the manager of Alloa Family Centre, which previously, prior to COVID and lockdown restrictions, had been a really vibrant hub in the community. There had been lots of different groups and different things happening. It was really well attended by families. However, as a result of lockdown and potentially a bit of a change in use for the family centre, it was used predominantly as like a contact centre for families engaging with social work services. Post-COVID, it hasn't been as well utilised as it had been previously, and there had been almost a bit of a stigma around this centre because it was seen to be a service for families engaging with social services. So we really decided to try and regenerate or get the public and the communities more interested in using this fantastic resource that they have, and also try and support something that would be in line with the Planet Youth data. During the summer holidays, as I said, there's quite a limited provision for family time, especially during the summer when young people and children are out of school. There is that little bit less structure around their day. So we co-facilitated our summer sessions as a collaboration between the social work team, ourselves, and community learning and development. And essentially ran them every week during the summer holidays. It was really successful. We had 160 people attended, 92 of which were young people between the ages of from birth to age 15. And it was a whole family setting. So parents, grandparents, carers could come along with all of their children, and there was activities and different things available for all ages, essentially. As you can see, it's been really, really well received by our local community. One of our parents said having these sessions has meant so much. I have space to talk to others in the community, and her child has an opportunity to play with other little ones. That mum actually lives quite rurally and was quite isolated, and was really, really positive about her experience coming along. We love how fun and relaxed the family centre is, which was really what we were trying to achieve. As I mentioned earlier, the centre did have quite a negative perception, perhaps, within the community, but it was a really, really fantastic resource. Lovely little group to bring my little one during the holidays. She's enjoying coming and doing lots of different things every week, socialising with other kids. And me and the kids love coming here. We met new friends and we love all the staff. And one of the things that was really, really key was that sense of community within the parents as well. Parents were having lots of conversations about things like sleep, concerns that they may have about their children. They were able to learn a little bit about Planet Youth, and they were also able to access supports from the early help team if that was necessary. These summer sessions have now continued. We have a hub every Monday that is a one-stop support shop. Try and say that 5 times fast. Or a family support hub where families can come along with their children. Children can take part in activities, and there are staff available to support with things like applications for free school meals, applications for uniform grants, or any other supports that's needed. And as you can see from some of the photos, it's been really well attended. That stigma is no longer there for this centre, and it's now going back to the vibrant hub that it was pre-COVID. And as you can see from some of the quotes here and some of the impact statements, it's been really, really, really positively received by the local community as well.
Hi everybody, I'm Alison Monroe. I'm Principal Teacher for Attendance and Engagement in Argyll and Bute, and with me today is Rachel Wales, our Youth Engagement Officer with Police Scotland. Can we move on to the next slide? Thanks, Morgan. So you can see here some of our authority data within Argyll and Bute. So this is results from our survey completed in autumn 2023. At that time, 5 of our 10 secondary schools were involved in the survey, and we had a 76% return of our S3 and S4 pupils. We focus here on the 4 key themes that we feel are most relevant for today's discussion. So a couple of things to highlight. In particular, we recognise the low participation in physical activity, but we recognise that our young people tell us that they don't just want to attend sports clubs, they're looking for other opportunities to be involved in, for example, the arts, youth groups, etc. as well. Again, like Laura just said, we also have issues with transport. We don't have many clubs on offer within walking distance, for example, and quite often our buses, the last bus at the end of the day is the school bus, so children and young people in our more rural areas can't get home after school hours. Also, in terms of screen time, you'll see there that there's quite excessive statistics around our screen time and the use of screens that young people are using. But within our rural locations, that is one of the key ways that our young people keep in touch with their peers. So it is something that's quite important to them to be able to have access to. And another kind of statistic that we are not unaware of or not unsurprised by, but a bit concerned about, is that only 20% of our young people would want to continue living in their community in the future. And we quite often see our young people leaving when they finish school and moving on to other areas. So if we now look at our local data for Dunoon, just to give you a bit of context, the estimated population of Dunoon is around 8,500 people. Generally, we have an older population compared to the national average for Scotland. So it's become a popular retirement destination and a significant number of elderly residents, but that then results in limited opportunities for our children and young people. We recognise here that some of the mental health statistics aren't particularly great, or they're not particularly high in terms of how young people are feeling about their mental health being good or very good. There has been further work done around this from the data that we've received, and our local secondary school are leading quite a lot on this just now in terms of looking at other assessments and supports for young people's mental health and wellbeing. Another concern was the number of children staying outside after midnight, once or more in the past week. So bearing in mind that the children that were surveyed are 14 and 15, and that, again, thinking about our 14 and 15-year-olds, a fifth of those surveyed are using e-cigarettes daily. So again, something else of concern. As I say, we work quite closely with the school. They have access to this data and they look at the information as well and think about what supports need to be put in place within the curriculum and within the school. So following on from the local data, we then had a wider consultation. So in September 24, we held a Growing Up in Dunoon event. This was a community event where we asked local professionals, groups and organisations who have a role to play in the lives of children and young people aged 0 to 18 to come along and have a stall or an information board which informed parents and carers of what's available in the area, both in terms of support for them and for their children, and also any local activities, activity clubs, sports organisations, etc., which their children could be part of. And prior to this event, we met with local head teachers in our 11 primaries to think about what the current risks and challenges are for children and young people growing up in the area. So again, thinking about that upstream, thinking about the information of what we need to know about our young people currently to improve that for survey data later in their years at age 14 and 15. So concerns that were highlighted by the head teachers included early and unsupervised mobile phone use, lack of sleep, vaping, and the use of social media. And so we then developed a series of questions which we asked our primary school children to complete. So things like, what age should a child have a mobile phone? What age should a 10-year-old go to bed? Things like that. And at this event, we presented this information to parents, carers and stallholders. And we also asked those present to contribute their answers to these questions by putting post-its onto the posters that were displayed around the room. So one of the things that we talked about were improvements that can be made for children and young people. So you can see our children in our more rural areas asked for more children to play with. They also wanted swimming in their village. In the more urban areas, they talked about tween-friendly things to do. They wanted the roads and pavements to be fixed. They also would quite like a bridge to get to Glasgow, but I don't see that happening, certainly not within the realms of Planet Youth. In terms of parent carers, though, they talked about somewhere in the town for teens to go and a wider range of supervised activities that were free and affordable that weren't necessarily related to religion. And that's because we currently do have a youth club that's run by our Church of Scotland. So we then took this information back to our Planet Youth coalition group and our local action group. And included in this group is Rachel, who's our Youth Engagement Officer, who's going to tell you a wee bit more about other risks that we recognise in our community. Thank you, Alison. Yep, so if we can just go to the next slide, please. Thank you. Some of the limited opportunities that we found is in education and employment. Young people in Dunoon and the kind of surrounding area have fewer education, training and job opportunities compared to larger towns and cities. Now this can leave, as Alison said, younger people to leave the area to go to Glasgow, Greenock for better prospects. So again, that links in quite nicely with job availability, with it being a rural area, there is limited job market, and that can contribute to financial insecurity and lack of opportunities for young people, making it harder for them to build a career or gain some independence. Social activities, there are fewer social activities for young people, which can lead to isolation and some boredom from a lot of them, which then turns into them maybe being a bit risky, taking risky behaviours. Mental health issues, due to the isolation, we are quite remote. Although we do have a boat that you can get over the water, we are still quite remote. And the wider Cowal area can make young people feel isolated, particularly if they have limited ways to connect with other people outside of the area, local transport that's already been brought up. Limited services and mental health that are less accessible, and there may be stigma around discussing mental health issues, making it harder for young people to actually go out and seek help. Substance misuse and risky behaviour. Substance use, in some cases, young people are turning to alcohol and or drugs due to the lack of activities or peer pressure, or what they're seeing going around about them. Peer pressure in close-knit communities like Dunoon, they do feel a little bit more pressure to engage in these risky behaviours if their friends are doing it. Some economic factors, rural poverty, economic challenges in the area may affect some young people, leading to greater uncertainty about their futures. Like we've mentioned a couple of times now, limited transport links, so Dunoon's location and limited local buses can make it difficult for young people to access education, jobs, social activities that other towns and cities have more of. This is then limiting their opportunities. Crime and anti-social behaviour. So Dunoon is generally quite safe. Like any community, there are obviously incidents of antisocial behaviour or minor crimes, especially within younger people, and they're looking for different ways of excitement or ways to pass their time because there isn't that much to do. You can just go to the next slide, please, Morgan. So in relation to addressing the risks, I, as Alison said, is the Youth Engagement Officer here in Cowal and Butte, and I started doing that in May, and heard about Planet Youth and thought that it'd be good to come on board. Now, the services in certainly the area of Dunoon, there aren't very many for younger. Well, there's lots for young people to do, but I think that the space for them to hang about, there isn't actually much in terms of that. So one of the ways we're trying to do this is opening a new youth club, which we've called Social 22. We are in the process of starting this youth club up. We've got a committee of 8 of us, which includes myself and other members of the police force, the local Developing the Young Workforce coordinator, local youth workers, and support assistants from local schools as well. So we've covered quite a range of people in the core committee. We're committed both professionally and personally, from all of us living in the area, to improving the outcome of young people in Dunoon. So yeah, some of the successes. So what we found was very important was the voice of young people. We might not like to admit it, but we are a little bit out of touch. So it was very important, certainly to myself and Alison as well, that we spoke to the young people of Dunoon and asked them what they would like. So we did some consultations with the school. We were in the school speaking to the young people and included them in visiting some potential venues that we would like to have
have the youth club in as well. We also held a logo competition, and in that previous slide, one of our very talented young people created the Social 22 logo for us, and they got an Amazon voucher for part of that. Again, that was something we found was very important, that it was something that was made by them. Also, the youth club, as a lot of us would remember it, there's a bit of a stigma to that. A lot of younger people don't like to be called youths, and we've struggled a little bit with that, I think, because they don't really know what it is when we're saying it's just somewhere where you can hang out, and trying to not use youth is quite difficult, but that's where our terminology has to start changing. So we are trying our best to include as many local businesses as possible in amongst this as well. There's lots of little cafes, shops. There are other youth services out there, sports clubs and things like that as well. So we're hoping to include everybody in that, and maybe do some promotion of what else is going on in the town, maybe getting some businesses involved and maybe getting discounts and things like that if we can do that too. So that will be helping the whole community as opposed to just the younger people.
And in terms of the challenges, this is something that's just started kind of within the last 6 to 8 months. We are having some issues with the initial startup, so things like opening a bank account seem to be quite tricky, and there's quite a few logistics around that. Thinking about having insurance and having some initial funding as well to get started is proving challenging, but there are ongoing conversations, and there's lots of people that want to help. It's not that we don't have the help, it's just trying to secure that and pin people down for what they've offered, and making offers, promises, I suppose. Also the time and capacity of the committee, we are taking this on as an additionality to the roles that we have in our personal lives, so that's kind of not stalled things, but it does limit how much we can do when there's a small team of us taking that forward. We're now at the point that we're ready to recruit volunteers, but again, we're going to have to think about the process for that and how we ensure that we have volunteers that are committed to being part of this youth club, because we obviously don't want a change of faces too often for our children and young people. And then thinking about PVG training opportunities, first aid courses and things like that. So things aren't happening quickly. Rachel and I like things to happen really quickly, and that's, yesterday would be good. So we're not quite there yet, and I think it's important to highlight that there are challenges around this, that we recognise that this is something that our community would really benefit from, that our children and young people want, and it provides that space that would keep them off the streets at the weekends and provide that kind of safe space for them to be in. And through that, the group, particularly the committee group, can be working with young people to think about how we create these healthy environments and how we provide these better outcomes for young people, the conversations we're having with them around keeping themselves safe and healthy. But we're not quite there yet. So with that, I'll pass back to Morgan and Zahra, and I think it's over to questions.
Yeah, thank you both so much. I think what's really important with both stories, I think it's really important to remember that the things that both Clackmann and Shirt and Argyll and Bute are talking about are one of several things happening. This is something that they're keen to highlight and that's happening, but they are one thing of many things that are happening. And I think it's really interesting hearing the process and how people got to that point. And a reminder that Planet Youth is all about that process of how did we get there. It's the joining of the dots, it's the people of coming together and utilising the data to make those local actions. But I'll stop sharing and pass over to whoever's leading on the questions. Thank you all so much.
Thank you very much. Hi everyone, that's been really interesting. I'm just going to talk a little bit about the work of some of the things that Scottish Drugs Forum's been doing. I'm Chief Exec at SDF. Really interesting presentations and really great to see how that's coming together in a local level, and I'm sure there are lots of things that we can learn from each other in terms of this as well. There's talk around terminology and getting that right, and I think that's also relatable to the substance use sector as well, making sure we're getting our terminology right around that. So just before I invite people back onto the panel, and please do keep putting your questions in the Q&A box for me rather than the chat. I know what's going to happen. Everybody's going to flood that Q&A box now while I'm talking, but I'll try my best to get through as many questions as we can. So SDF's been involved in a number of pieces of work in relation to this. So we were lucky to be able to send a staff member over to Iceland to also visit some of the Planet Youth sites, but also for the conference over there last year, which was really beneficial to have that insight brought back to us as an organisation, and attended the Women Scotland event last year too. We've been involved in contributing to the Public Health Scotland consensus statement on young people and substance use, which somebody's also asked about in the questions, and we believe that should be published around the summer this year. But probably our most significant work has been around our workforce development, particularly with the Glasgow Health and Social Care Partnership and the Alcohol and Drug Partnership on prevention and early intervention work. So we've had contact with around 250 young people from age 16 to 25 through a number of different services, and also collaborating with other organisations such as Action for Children. And these sessions are really interactive with young people, using tools like Kahoot for polls, scenarios, quizzes, and young people are really involved in small group work exercises and enhancing young people's engagement and confidence through providing feedback and group discussions. So we've delivered face-to-face training to a number of organisations in Glasgow, including G20 Youth, Quarriers, Govern Youth Information Project, and loads of professionals and from both statutory and third sector organisations, just to enhance the knowledge of substances in the context of the lives of young people in Glasgow. And some of the emerging trends relate really closely to what people have also talked about throughout the sessions. So some of the trends that we've identified, and thanks to colleagues Trish, Graham and Adele for pulling this together, have been around the increasing role and pervasiveness of social media and digital access to substances, the rise in mental health challenges and long waiting times for treatment, applying for young people also, and particularly identifying needs for support with neurodiversity. There's some issues with the word recreational that's often used when we're talking about substance use by young people. And when the reasons are explored for people's drug use, it can often be far from what's being perceived as recreational. A lot of discussion around early use of substances, including vaping and energy drinks, and that can be as young as people being in late primary school. Inconsistencies or lack of data collection, particularly around the SALSIS information no longer collected, and health and wellbeing surveys in school not consistently carried out. Or not uniform across areas. And then the last sort of thing really being about strong or aggressive marketing tactics, particularly for purchasing of substances from supermarkets or online, to then illicit drug menus on mobile platforms. So I guess those are just some food for thought when we're getting to the questions, and I'll post some information in the chat as well about some of the training on offer that we can support organisations with. But without further ado, I would like to invite everybody else to please put their cameras back on that are taking place in the panel. And I'll just get to it in terms of some of the questions that have come in. So one of the first ones there is in relation to the discussion earlier about unexpected findings like poor sleep and change in school hours, which has been done in Iceland. What do we think about that emerging for Scotland? Is there appetite for us to be moving towards that? Any thoughts around there about the motivations there? Thanks.
I'm happy to start off on that one. I think there is. I think it depends very much on who's the local coalition. And one of the things that Morgan has spent a lot of time on in the last 18 months is looking at who is on a coalition. Because what we found in the beginning, if the lead area was education, for example, they would come to us and say, we've got a really broad coalition. And we'd say, who's on your coalition? And they'd tell us. And I'm like, that's not a broad coalition. That's all education people. Now, it might be broad from your point of view, but actually, and it's great that you've got the college in, and it's great that you're looking at early years, but actually we need to be talking about businesses and third sector and the people who you wouldn't normally talk to. So I think where there are broad coalitions, and Highland are doing something interesting. They've got coalitions around each of their high schools, which really speaks to this place-based aspect of Planet Youth, which is, so I live in Glasgow and Shawland. I care about Shawland, don't really care about the rest of Glasgow that much. So having that stake in your local area and knowing in a really detailed way what the young people are telling us is, we are seeing some people concerned about smartphone use, for example. That's the big thing that's come out, and sleep. So the appetite for what we do about it depends on who's getting that information locally. And one of the things about Planet Youth is you share that data far and wide, whether it's with parent councils, whether it's, you know, whoever it is, so that they can take the part of the insight that is relevant to them. What we shouldn't have is a coalition sitting there like a dragon on this pile of gold dust. We want different areas of expertise within a local area having the data that they can do something about, because otherwise you look at this data and it's scary and there's a lot of it and you think, well, we don't even know where to start. And sometimes people go straight to the most scary part. So there are questions around suicidal ideation and abuse and some really things we don't want to be happening in this country. But it's not all of our job to put all of our resources on that. And actually, I wouldn't be a good person to do that. But I'll give a personal example. I'm on the parent council of my daughter's school. So actually, if I had that data, there's some stuff that we as a parent council absolutely could get our teeth stuck into. So giving the data to the right people will hopefully mean that there's no area that's left untouched, which I think was happening in the first part of the pilot, where people felt that it had to all be kept together and sort of protected. So yeah, that's what I see at the national level. I'm not sure locally, Laura, Alison, Rachel, if there's anything different or complementary that you guys are seeing in terms of the non-substance insights.
Yeah, I think we would just say that we have shared our data as widely as we can. We've invited, so the Planet Youth provide a stakeholder wheel that has suggested people around it, so it isn't just those in education or health, or as you say, Zahra, those that would usually be part of conversations around children. And it's been really interesting, I think, particularly, so we also have those local community coalitions attached to each high school. And it's been really interesting to think about, well, who else comes on board? And when you share that stakeholder wheel, it opens up conversations of, oh, well, I think they might be interested, or we'll bring them on board. So that's been really good. And also we reached out to parent carers in each community with a generic email, which meant that some people who maybe wouldn't have come along because they weren't part of the parent council, for example, but maybe had an interest because of their employment or their own interests and things. There's a few people that are aware of Iceland and what's been happening that want to come on board. So that has allowed us to broaden and share the data and share the insights as well, and have those open and honest discussions about it. So yeah, I think you're right. It's about who you bring around your table and making sure that you've got people around the table that are going to contribute and kind of lead on that.
And we've been really lucky in Clackmannanshire as well. We only just have the one coalition, and we do have representatives from lots of different sectors. And we also have a member who is the chair of the parent council for Clackmannanshire. So we have a council-wide parent council. Individual schools have them, but then we also have a council-wide one. We only have 3 schools, so it lends itself quite nicely to the local context here. So we do have quite a wide representation, I would say. I think one of the challenges has been with that, though, is that everyone has their own fields of interest. When it comes to sharing data, disseminating it, having discussions around the implications of it. One of the challenges I've found in that aspect, though, is that different members of different organisations, or depending on what their role is or what their personal or professional interests are, they might want to look at different or focus on different areas of the data, which can be, for us, I think, can sometimes be a bit of a challenge, but I'd say it's definitely more of a strength than a challenge, to be honest.
Okay, thank you very much. I'm sure we'll come back to some of those issues too. So next question, do you see any connection between the 12-step process and quality improvement methodology?
I think the question is the 10-step process, and it's the youth, our 10 steps. I don't know the answer to that. I mean, there's lots of different quality improvement methodologies. I don't know what specific one it is, but in terms of engaging stakeholders, absolutely. In terms of experimentation and trial and error, and putting together get your data, put together a hypothesis, do some experimentation, evaluate it, and constantly be working on it. That test of change model, that's absolutely at the heart of Planet Youth. And I think that's one of the hard things about it. When you talk about prevention, it can be really difficult to attribute any success to one single intervention. And we find that with people coming, and actually I spoke to a journalist a few weeks ago and we had like an hour-long conversation, and I thought it was really good. And at the end he said to me, so Zahra, if there was one thing that Iceland did, what would it be? And I was like, well, you haven't listened to me at all, because it's not one thing, like it's lots of different things, and it's about trying it. And actually Argyll, Bute, Highland and Clackmannanshire might have all had exactly the same survey results for one set of questions, but the action that they will take will all be completely different depending on the community that they are living in. And actually, even within Clackmannanshire, it's a funny example. I think that one of your colleagues, Laura, told me that what you do in Alva Academy might not necessarily work 2 miles down the road. So there's, within that, there needs to be experimentation, which I think does tie into some of the quality improvement methodologies. We're also really keen on working with organisations who know more about some of this stuff than we do. So Public Health Scotland have been really supportive. We've spoken to a lot of their staff, and they've given us advice and guidance on different things, as well as some other, Young Scot and the Institute Directors and Sports Scotland. So we're trying to make sure this is not seen as an extra, here's something else for you to do, but actually here's a tool that can help you do what you want to do better, which I think ties in again with some of the quality improvement stuff.
Thanks, Alison. Did you want to add something to that? Were you? No, you're good. Okay, there's quite a few questions that I'm going to just sort of group into one type of question, and it's around that sort of more in-depth information around what have they done in Iceland to specifically reduce drug and alcohol use. And also, what's the plans here around extension and moving beyond the pilot programmes and extending to other areas?
Morgan, are you happy to talk about Iceland?
Yeah, and I think, Zahra, you probably just answered that in terms of, there's not a one answer. Iceland did lots of different things, and I think what they did was the process of Planet Youth. What they did was listened and acted, and the local decisions were very different. I think we have to acknowledge the fact that Iceland were able to really have the political momentum. They were able to really have that as a different context. So they were able to do things like change some of their laws, change some of the things around marketing and things like that. And those are things that we're all still working towards and still would like to see happen in Scotland. But the big thing that they talk about that I think is always really important, and it's actually, and I guess one of the other questions is, people were invested in improving things for their young people. So parents cared about this. Parents wanted to be involved. Parents and carers and community members really galvanised any sort of big decisions that were made politically in Iceland came from communities making noise. It came from them hearing that this is what was going on in their local area and how can we do something about it. So some of the really big things that they often talk about, and again, people get confused with the stuff. The stuff isn't what Planet Youth is. The Planet Youth is the approach that gave them the stuff. Some of the stuff was things like leisure cards for their kids to be able to access some out-of-school activities. They looked at outdoor hours.
Being outside after 10 o'clock is a real risk factor. So kids who are outside after 10 o'clock are more likely to be indulging in risk-taking behaviours. So in Iceland, they invested a lot in educating parents. How can we empower parents to understand that this is a risk factor and it is a big deal? And a huge part of what worked in Iceland was educating parents, not lecturing them, not making them feel bad about the decisions that they were making, but sharing the data so that they could see. Because I have an 8-year-old, but I was fostering a 15-year-old, and sometimes it felt like no matter what I did, it didn't matter because she was going to go and do what she wanted to anyway. Actually, what the data told us is it really matters what we as parental figures do and say and what boundaries we set. And I was talking to actually one of the ministers in Scottish Government, and she said that when she was raising her children, one of the hardest things about making decisions around alcohol was other parents who were saying, oh, it's all right, just bring them round to my house and, they can have a couple of blue WKD. So empowering and engaging parents, sharing this information with them. So in Iceland, it was about making sure your kids are home before 10 o'clock, about setting boundaries, about having those difficult conversations. In Iceland, they talk about this cliche that has become, a saying that's become a cliche, which is, I'm going to say no because I love you. And I think we find that quite difficult because we just want our kids to be happy and we want to be their best friends. But the data tells us, and I'm not very good at remembering the numbers, but where parents have set boundaries around alcohol, children are much less likely to start drinking at the age of 12 or 13, and much less likely to be drinking as much as peers where they think that their parents don't care. Same with school. So they were looking at the relationships in school and how important that was. So that was another thing that really helped in Iceland. And I have to say, though, Icelandic parents were not all at the starting line, ready to go. The first sessions that they had in Iceland to talk to parents, there was 2 people that came along. And then the next time there was 3, and then the next time there were 4. So those parents are not so different to us. I was talking to someone who is a parent in Iceland who's a wee bit older than me. So she grew up in Iceland just as this was kind of starting off. And she said that she parents completely differently to how she was parented. And it's much more hard work, and she's a lot more hands-on than her parents were. But she wouldn't change it for the world because she can see that investment that she's making. And also she's not the only parent in her cohort who is trying to enforce these rules. So back to the point about smartphones, we know there's grassroots movements in this, well, not so much in Scotland, but in England around smartphone use. That is bunches of parents getting together to say, actually, we don't want our kids to have smartphones when they're still in primary school. And if none of your kids' friends have got smartphones, they're not going to want one. It's much easier to be one of 20 parents who are saying something than one of 1 parent. So Iceland was about empowering parents, helping teachers to see the value not only of the maths that they're teaching, but the relationships that they're building. And then on the sports side, another misconception about Planet Youth is it's about getting kids into sport activity after school. Our data makes it really clear that sport is a protective factor when it comes to well-being and health and kids feeling better about themselves, but that is almost entirely down to the coach. So it doesn't matter what sport they're doing, and you could have kids doing a sport. I got in trouble because I mentioned rugby at one of these things, and I got in trouble for people thinking I was picking on rugby. I wasn't. It's just I'll just pick it out of thin air. You could have 2 rugby clubs in 2 different areas with 2 different coaches, and in one area those kids are healthy, happy, safe, they're making good decisions around what they do with their spare time. And in another club where actually kids have started drinking at 12 because there's a drinking culture in that club, and the coach is standing by the side of the pitch vaping. So it's about saying to those coaches, do you know how important that you are, and just how much of a difference you as a role model make, as opposed to someone who's teaching rugby. And in Iceland, they actually pay their coaches. So that's another huge culture thing. And I don't know if we as a country could do this, but if you're coaching any sport in Iceland to young people, it's your paid job. You've done all the training. You've done all, I'm not saying our coaches don't do training and qualifications, but when you're doing it as a voluntary thing, as you guys were saying in Argyll and Bute, it's hard when you're doing it on top of your day job. So Iceland have prioritised, let's invest in these adults so that it makes it easier for them to do the things that we want to do. But it's the combination, and Iceland talk about, you could invest, Morgan showed the picture of the 4 different quadrants. You could invest all your resource in the home quadrant, and actually that wouldn't make the difference that you need to make. You need to have investment in each of those 4 quadrants so that everywhere young people turn, they see wonderful things they want to do with their lives, whether it's at school, home, with their friends and colleagues.
Thanks, Zahra. And sorry, Morgan, you got frozen.
Apologies, I was talking for a while and you maybe didn't hear me.
I'm sure you've got other things to add. And Laura, Alison and Rachel, please do feel free to chip in as well. I'm just going to add this other question into the mix, and you've touched on it there, Zahra, and probably almost fully answered it, but just in case you wanted to add anything else to it, it's around engaging parents. So do you have any information how to engage with non-engaging parents? So really trying to get the parents involved. Like you said, a lot of the stuff you've talked about is about relationships, and that it's relevant to so many different sectors that we work in as well. But in terms of the engagement with parents, is there anything particular you wanted to add to that?
I think hopefully you can hear me and I don't get kicked out. I guess one of the really interesting things that's come up, I think, as Zahra said, I think it's really important very early on when we started doing some of the training around Planet Youth, we banned the word just, because actually it was never just one parent that came along or just 2 parents. It was 2 parents, it was 3 parents. And I think having that confidence in the fact that those 2 or 3 parents, if we get this right, will then go and talk to another 2 or 3 parents, and if they're the right parents, and that's sometimes really helpful, if they're ones that are going to speak loudly and believe in this and spread the word, then that's really amazing. I think one of the interesting things we've had a lot of discussions about is going to where parents are, and lots of these parents are in work, they're volunteers, they're part-time employees, they're full-time employees at their local shop and their local businesses and their local factories. So some of the areas have started exploring that and trying to work with local businesses by saying, can we come along on your lunch break and just have a stall? And actually we're here to maybe share some of the data and some of the insights, because one of the big things that engages parents, as Zahra sort of answered there, was when parents find out, quite often we think, right, our kids turn 12 or 13 and they suddenly just don't care what I think, and it doesn't really matter what I'm going to say because they're just going to do what their friends think. I suddenly have no power. When we can give parents this insight and this data, the fact that actually how you behave, how you think, how you have expectations of your kids has direct impact to their behaviours and what they do, how they believe in themselves, how they act. That's really empowering for parents, and those non-engaging parents maybe are non-engaged because they're kind of thinking, actually, what's the point? And I think it's really defeated being a parent. It's a hard job, and it's really difficult to navigate when you can give some of that power back about the fact that actually you really matter and there's something that you can do here. I guess the trickiness is how do you get that insights to them when it's difficult for them to maybe come along and do things. So lots of things have been trialled in different areas. Laura, Alison, Rachel, there might be things you want to share about what you have tried. I think it is about how do you get to where parents are. The businessy side of things has been a really interesting thing for us to start exploring.
For me, one of the things that, why would drug policy be supporting, Planet Youth in the way that it does? And I think one of the things, we talk a lot about stigma a lot of the time, and I think one of the things that I really like about Planet Youth is that kind of, this is a whole community thing, because I think one of the things that keeps parents away from engaging with their community when they are struggling with substance issues, either for themselves or for their children or their loved ones, is that label that then gets stuck on people, like if this is about preventing drug use or preventing all, and when this is just about being a parent or a carer, and what are we, all of us, going to do about this? I think a lot of the time it's so much easier for women, I say women, but people to sort of engage much more readily with that, even as you say, as if it's harder at the time, than it is to say, I'm worried about this. And that might happen. And of course, those particular groups are important for those people who can't at first. But I do think that whole community thing is crucial in terms of us all acknowledging that this is something that affects all of us. Sure, some more than others, but it's really important to make sure that this is a whole community thing, that everybody, that you don't need to put your hand.
It's interesting, Alison. I was speaking to colleagues at Angus on Monday, and we kept laughing about the fact that this should be called Planet Adult rather than Planet Youth, because it's absolutely all about all of the adults around a child's life. And I think it's interesting about that thing about businesses as well, because I guess it is about, yes, it's about parents and carers, but it's also about big sisters and brothers and cousins and aunties and uncles, and that family friend that is your role model you look towards. And I think we capture them in lots of different ways. So no, I think it's really important we think about that. And yes, it's Planet Youth, but a lot of it is about Planet Adult and what are we as adults doing.
Thanks. Laura, were you going to come in before? And then
I was just going to add in that we've very much done what Morgan has said and gone where the parents are. It's not necessarily that we've set up anything new as such, but the parents that we have engaged with have engaged really, really well. And I do think that there is a sense within a lot of the parents that we're engaging with that a lot of the services, a lot of the conversations about young people's well-being, mental health, substance use, are quite negative. And that maybe certain things that have been in place haven't always been successful. It's a real worry for parents. So when we're trying to engage with parents about this is something that's slightly different, something that's new, I'd say there has been a real appetite for parents to engage there. We haven't engaged with all parents that we would like to, but the parents that we have engaged with have responded really, really well, which has been really positive.
Yeah, I think we would echo that. So there's a couple of things to add to that. So firstly, obviously, we're aware that the majority of the parents engaging are those that tend to engage with their children anyway. So those that are on the parent council, those that do attend parents' nights, that kind of thing. So we are aware of, and we're working with our primary schools to identify those parents that we maybe aren't reaching and ways to reach them. So that might be in the playground at 3 o'clock at school pickup, or attending like a school event that they might attend with their child, a Christmas fair, that kind of thing. Another thing that Rachel and I did was we joined our early years do buggy walks for like their 0 to 2s. So we've gone along to a couple of those and kind of just shared some insights from the data around you know, have you thought about when your 2-year-old is 10 if they're going to have a mobile phone or not? And I know that that seems quite tricky for parents, and we share that with them. You know, we know that these are decisions you're thinking about what your baby's having for dinner, or what time is their nap time, so what time can I put them to bed, you know, all of those kind of day-to-day decisions. But actually in the longer term, thinking about what that might, you know, those decisions around mobile phone use might be, and they're in the process of being part of these buggy walks and building their community around them and around their children. So sustaining those relationships to be able to make those decisions, as you said, Zahra, you know, it's much easier if they make a decision as a group of parents rather than just one parent making that decision. The other thing we've done, and again, it comes back to kind of terminology, is Planet Youth doesn't necessarily mean much to people just now. They don't know what that is. And you know, we could call it Planet Adult, we could call it, you know, a prevention model. There's lots of language there. So we've kind of focused it around 3 key things. So we've called it growing up in, so growing up in Argyll and Bute. And we've gone to parents with kind of 3 key questions being, what do you like about the area? What's good for your children and young people growing up in this area? What challenges, barriers, improvements can be made about growing up in this area? And what worries do you have for your child in the future growing up in this area? And then we can use that information to kind of make those connections and link that back to the data and think about how we can move that forward and engage the parents in the answers that they've provided to us.
That makes me really happy actually to hear all that, because this is about upstream and that primary and early years. We cannot put the genie back in the bottle, and it's something Morgan talked about in her bit, that this is really sticky sometimes, because you're asking 15-year-olds, they're telling you some really tricky stuff, and then we're going, thanks very much, and then we're turning around that way. And that is because we're sharing the data also with people who can help those 15-year-olds, and we absolutely want that to happen. But once a kid's got a smartphone, like, you're not prying my smartphone out my cold dead hand. So why we think that 13-year-olds would give it up? They just won't. When you've started drinking, it's much harder to listen to that argument about why you might not want to. So having the conversation with parents when the kids are 9 or 10, before it's hopefully become an issue, is a much easier conversation to have, because it's hypothetical and you can set your boundaries around what you're going to do. And I think also sometimes we see some of these issues as being inevitable, and there's nothing inevitable about 13-year-olds, 12-year-olds drinking or taking drugs. Like, if that's the kind of world that we're living in, we may as well give up now. Like, we see that there's a way around this. Just a very small example from Western Bartonshire that I really like. They shared, it's a youth club that was involved, and they, like the other areas, realised that parental engagement was really key. So one of the things they did is just change their enrolment process. So rather than kids getting a QR code and the parent filling in all the information, like, you know, what you're allergic to and whatever, and that form going straight into the computer at the youth club, the kids left a phone number, and the youth worker phones the parents now and has a conversation where they ask exactly the same questions that are on the form, but they're having a human conversation. And they're doing that a bit younger now, so that if there's a problem further down the line, actually, I've already got a relationship with you, and you don't think I'm phoning you to tell you off for something. So a really small tweak to what they do, but it's based on the data, and it's allowing them. And actually, they've actually had some of their parents now coming in and being more involved in the youth club than they would have been previously. Rather than seeing it as a babysitting service, they see it as this is something that, you know, we can get involved in as we want to. So, as Alison keeps telling me, there's no new money. It's about looking at the money that we are spending and how can we maximise the effectiveness of that based on what young people are telling us.
Thanks, Zahra. And I'm sure we could continue this conversation for hours more. There's certainly lots of interesting other questions that have been put in, and I'm sorry to everyone whose questions have not been able to get to. I'm sure we'll need to revisit this subject definitely again in the very near future. But I'm just going to pass over to you, Alison, just for closing the webinar. Thank you very much, everyone.
Thank you very much. I feel like I have to speak really quickly now, because I think we're all going to get kicked out any second. So thank you, everyone. The event has been recorded, so I do believe that SDF will be, you know, like we'll be sharing it with everybody and the world shortly. But I think it has been incredibly stimulating and really, really interesting discussion. So thank you to all of the presenters. Thank you to SDF for the initiative. I think it's brilliant. And goodbye.